I'm Dr. Kimberly Keaton with the Medical, here to talk to you today about shockwaving the equine lung. We shockwave the horse's lung in order to help manage conditions such as EIPH and equine asthma. The technique for shockwaving the lung is quite simple and has few contraindications. However, the most important of those being we do not want to shockwave the region of the heart. In order to identify the heart, we start by spritzing the horse's thoracic cavity with alcohol. 2 reasons. 1, in order to ensure good contact between the coupling gel, the skin, and the trode. And 2, because it makes it quite easy to identify areas that we want to shockwave and areas that we want to avoid. The only area that we're concerned about avoiding is the equine heart. This is easily located at the level of the elbow, 1 intercostal space back, and 8 inches up. So I'm going to draw a square, 8 inches up, 1 intercostal space back, and this is the area that I want to avoid. The rest of the lung field that I can get to anatomically, I'm going to draw here. We can go as far cranial as the scapula will allow, and as far caudal as the caudal lung fields. We want to use copious amounts of coupling gel in order to ensure the best transmission of the shock waves between the trode and the animal. Our shock waves with this treatment are dissipating at the air interface at the level of the alveoli. I like to use coupling gel on both the animal and the trode in order to ensure the best contact. The technique for this treatment is going to involve treating all of this area, again, avoiding the heart. So we're getting 70 to 80% of the lung field. At this point, I'm just spreading my coupling gel. We're going to do this in a dorsal ventral fashion, following the orientation of the ribs. So we're riding along the ribs, treating the intercostal space, and allowing those shock waves to penetrate to the depth of the alveolus. Again, we're using the 80 millimeter trode at 480 hertz, energy setting E8. This treatment can be accomplished in many animals without sedation. This is a young warm blood horse who's not ever had shockwave before, so we're gonna try treatment without sedation and carry on. So again, using E8, 480 hertz, continually moving the trode, riding along the intercostal space by using the ribs at 480 hertz and 1,000 shots per side for the entire treatment. This treatment should take 2.5 minutes or so on each side, so a total of 5 minutes. So you see this young warm blood horse is tolerating treatment quite well. He is a vet horse, so he can be quite sharp. As you can see that he allows his lungs to be treated without sedation or any additional In order to treat both sides of the lungs, I would repeat the same protocol on the opposite side, again using the 80 millimeter trode at energy setting E8 and 1,000 chalks.